40% of Black Floridians have been vaccinated. Black and religious leaders in the state coming together to get shots to underserved communities. MSNBC senior national correspondent Chris Jansing is at Florida A&M and HBCU in Tallahassee, where the staff is getting shots today.
Hey, Allison, if I had to summarize what's going on here, it is trusted venues, trusted voices. They have a problem in Florida in general and here in Leon County in general. This is a place where about a third of the people are Black, but only less than 10% have actually been vaccinated. So community leaders, including the president of this university, other education leaders, faith leaders, ministers, community leaders in health centers have all gotten together and said, if there is a place where we can step in, where the government has not done what we need them to do for our community, we will do it. That includes, from one Baptist church, raising $250,000 to buy a medical mobile unit. Take a listen to what he told me.
What I'm not going to do is fight against the government per se, but fight against this pandemic. And to say to the government, you cannot do it by yourself. We have a group of leading citizens across the state of Florida have identified trusted venues and hear trusted voices that are saying, let's get this done. Why not work with us? Why not work together? The government is not the solution. The community is the solution to dealing with this pandemic.
There's a lot of frustration with the government, particularly here in Florida, and they know it's still going to be a little time before the Biden administration can get up to speed. So in the meantime, this group is getting together. They're getting vaccine clinics together in places like this, in churches. That's the trusted venue part of it. And they're telling people to get the vaccine. There have actually been ministers in this area who have suggested to people they should wait or not get the vaccine at all. So they're up against a whole lot of problems, but they believe that if they can put together very quickly a plan of getting the shots out, getting people educated, it can be a model all across this state and potentially across the country, a community state-federal partnership. Allison?
What will you feel like after you get your second COVID shot, and how bad are the side effects? The most common: headache, fatigue, maybe dizziness. CDC Director Rochelle Walensky saying today, plan to take it easy after your second dose, but still, please go and get one.
This should not deter you from getting your second dose, but you need to have a light day of activity after getting vaccinated. I want to be sure that you know the facts and not the myths about the vaccine safety. The fact is they are safe and they will save lives.
Let's bring in Dr. Richard Besser, former acting CDC director and president and CEO of the Robert Wood Johnson Foundation. Dr. Besser, we heard Dr. Walensky there being pretty straight with the American people. No, you might not feel great, but yes, these vaccines are safe. What else should our viewers know about how they might feel, especially after that second shot?
Yeah, your arm may be a little sore. You know, I think people have experienced this from having had flu shots in the past, but especially after the second dose, your arm will be a little sore. You may have some fatigue. Some people express dizziness. You know, one of the challenges is that not everybody in America has the opportunity to take off work that day after they get that shot, and that's something that should be in place. Everyone should have sick leave so that you can take that day. But it is really important to recognize that the reactions people are having, while not comfortable, are not serious. And when you stack that up against the potential seriousness of COVID infection, both in terms of the risks of hospitalization and death, but also from mild or moderate disease, the fact that there are people who have symptoms that go on for many months. It is so important to get vaccinated when it's available to you.
Dr. Walensky talked more about the CDC safety report, saying that 113 people did die after getting the vaccine. That report, though, says no causal link was detected between the vaccine and those deaths. Can you explain that a little more to our viewers who might just hear that number and think, ooh, I don't want to get vaccinated?
Yeah, so this is a really challenging piece of information to take in. You know, every day in America, there are thousands of people who pass away from many different causes. And so when you're looking at a group of 13 million plus people here and you're following them, on each day following vaccine, you would expect that a certain number of people would die from other causes, from a heart attack or you know, in a car accident. And so what you look at is, are there an increased number of deaths among people who got vaccinated, more than you would expect to see on any given day in America? And what they're finding, because they do detailed investigations of one of those deaths, is that no, they're not finding deaths that were caused from the vaccine. They're finding deaths, unfortunately, that are caused from cancer or other complications. The vast majority of the deaths that they saw following vaccination were in people in long-term care facilities, where you would expect to see a higher death rate every day of the week.
Dr. Fauci was talking about vaccines for kids today. Here he is.
We will likely get information for high schoolers at some time in the fall, but it is, I would say, more than unlikely we will not have data on elementary school children until at least the first quarter of 2022.
Dr. Besser, first quarter 2022 is still a year away. Does that concern you at all as we're trying to get kids back to the classroom as quickly as we possibly can?
Well, it's really important in terms of resetting people's expectations. I think a lot of people were expecting that there might be vaccines for kids for this fall. There will be enough vaccine for every staff member and teacher who works in the school, and that's really important since the risk to teachers and staff is higher than it is for children. But what it tells me is that, you know, you shouldn't expect that school this fall will look like school looked in 2019. It's still going to look a lot like school looked last year and this year, with children needing to keep their distance and to wear masks. The fact that you're going to be able to provide the added protection of vaccine to people who work in schools is a plus. But this is also, you know, an estimate. There are other vaccines that are under development, and the picture could change. But it will be very useful for school districts, for states and localities, for their planning for the fall, and in fact for the winter in 2022.
Pfizer saying this week that it's starting clinical trials for pregnant patients. What are you looking out for, and your advice for pregnant women when it comes to getting the COVID vaccine?
Yeah, it's good to see that they're undertaking these studies, because when vaccines and medications are first tested, women who are pregnant, people who are pregnant are excluded. They're excluded because you want to make sure that there's overall safety. But the challenge with that is then you have vaccines that are approved and you don't know the safety profile in people who are pregnant. And a lot of people who work as frontline workers, a lot of people in healthcare are people who are in reproductive age. So this will provide more safety information. And the current recommendation, I think it's a good one, is that people who are pregnant should talk to their doctors about vaccination. We know that pregnant people are at increased risk of having severe infection. So if you're in an occupation where your risk of exposure is high, the benefit from vaccination for most people will exceed the theoretical risk. Right now, scientists believe that these vaccines will be shown to be very effective and very safe in people who are pregnant. And so you wouldn't want someone to be in a situation where they're at high risk of getting COVID and they've avoided vaccine because of some theoretical risk.
Dr. Besser, you referred earlier in this segment to the long-term effects of COVID. A year into this pandemic, we are starting to get even more insight into those long-term effects. More than 30% of COVID patients still have symptoms 6 months after infection, according to a new study out from the Journal of the American Medical Association. Could you tell us more about what those symptoms look like and what else we are learning about the long-term effects of COVID at this stage?
Yeah, Allison, my high level takeaway is, when you hear information like this, it's why everyone should take this seriously. It's not just the threat of hospitalization and death, but we still have so much to learn about the long-term impact of the infection. In this report, what they found was that for those individuals who have what are called long haul COVID, fatigue, just being tired, having cloudy thinking, having loss of smell or taste. Those things can be quite debilitating, and there's a wider range of symptoms that people can experience as well. We're just learning about this, but it speaks to why it's so important we each do our part. We wear our masks, we keep apart, we limit our travel, we get vaccinated when it's our turn to be vaccinated. It's to prevent the whole full spectrum of COVID, and there's still so much to be learned.
Dr. Besser, I can't think of a better way to round out our week than having you on. Thank you for always coming back to see us.
Great to see you, Allison. Have a great weekend.
Thanks, you too. 72 and sunny, the high today in Los Angeles, California, but more than 12,000 vaccine appointments there were postponed because of weather issues elsewhere in the country. The shots simply couldn't get to Cali. It's the latest challenge for a county that is just really breaking out of its status as the epicenter of the coronavirus here in the U.S. That's what NBC News correspondent Jacob Soboroff is talking about in Street Level USA. It is his new series of special reports airing on Peacock. Jacob, first of all, congrats on the new series. And thanks for coming on to preview it with us.
Thank you so much, Allison. Good to be with you as always.
In that first episode, you catch up with the chief of the LA Fire Department. What did he tell you about the challenges they are dealing with in LA?
Well, if you remember Los Angeles at the beginning of the pandemic, we locked down pretty much first and fastest and hardest. And the consequences were extraordinary. 1 million people lost their jobs. But, here we are at the beginning of 2021, after having been at the center of the virus for several months. California and Los Angeles became the epicenter. Despite all of that, California has obviously had some significant challenges. And what the fire chief told us was that exactly where I met him, Dodger Stadium, today. It is locked down. It is not open. And that is because of a different challenge, the weather to get those doses here. But supply has long been a challenge. And he explained, weather aside, why that has been the case before today. Watch this. Is the lack of a supply because now there's a bigger pool of people that are eligible to be vaccinated?
That contributed to it.
Was the pool of people who are eligible expanded too quickly? Is that part of what happened here?
That did happen.
Is there any chance that age only allows some of those essential folks to slip through the cracks and have to wait at the back of the line?
You hit it on the nose. People who have a higher likelihood of exposure might have to wait longer now because we're letting older people go first, who may be retired and really don't get out a lot.
So, again, Allison, we look to answer that question. How did this happen? How did we get here? In a big blue state with progressive policies and progressive politicians, how did LA become the epicenter? And you heard the fire chief there talk about this policy that 65 and older, making a broad pool of people who are elderly, I guess you could say, although my parents would want to disagree with that, was part of the plan. But what happens with essential workers? What happens with people who have long been subjected to policies that are unequal? Inequality is a big part of the reason that we got here.
Yeah.
And it's part of the problem with the vaccine distribution as well.
Yeah, Jacob, also, you got to be real careful when you wade into that age territory with parents. They start to qualify for ARP and things like that, but they still think of themselves as youngsters.
Big viewers of yours,
I go
Allison.
through that.
That's why I was watching my words there.
Mom and Dad Soboroff, all of our respect. You are youthful in our eyes. I go through it with my own folks. My dad is now 70, and it's weird to me that he qualifies as elderly now because he hardly sees himself as such. So let me ask you, how is Los Angeles? How would you say the rest of California is doing now? How would you characterize where your state is? Well, we're leveling off, but the numbers here are, and they go back to about the numbers right before the surge. And what I really want to underscore is that when you look at California and look at Los Angeles, you can understand, and we get into it in the special,
how we got to this point. It's a city with more homeless people, unhoused people than anywhere else in the country, over 60,000 in Los Angeles alone. We have an undocumented population of 1 million people who were not able to access both financial and other types of relief when this pandemic hit. And that list goes on, and we get into it quite a bit here in the special that's coming up on Peacock.
All right, Jacob, thank you so much for coming on to preview it with us. Congratulations and our best to your folks.
Thanks, Allison.
And you can catch Street Level USA with Jacob Soboroff streaming tonight, yes, tonight, at 10 p.m. Eastern on Peacock's exclusive news channel, The Choice, and on demand. Free pot with your shot. A Michigan dispensary offering free weed if you get your COVID vaccine. NBC News correspondent Shaquille Brewster is there.
Hi there, Allison. Well, yes, we have seen this model before. I know you remember maybe going to some places with that I voted sticker back in November and being able to walk out with the free coffee or free donuts. Well, here in Michigan, as people are trying to increase incentives for folks to go and get that coronavirus vaccine, one dispensary is giving people a free pre-rolled joint for that proof of vaccination. You come in with your vaccination card and you can walk out with that joint there. And I had a conversation with the owner of this dispensary who came up with this concept several weeks ago. They've been doing it for about 3 weeks at this point. And he said, look, I'm not getting into the politics of it. What he wanted to do, he says, is provide a bonus, an incentive for someone who went and got their vaccine, a little way for him to say thank you for doing that and doing your part in helping to bring an end to this pandemic. It's just been about 3 weeks, and he says that he's already spent somewhere between $30,000 and $35,000. That's how much many of these pre-rolled joints that he has been able to give out so far. And he announced today that he's actually going to extend that even further. Listen to a little bit of my conversation with the owner of this dispensary, but also with the city manager. Listen to what he said, the impact this program has had on this area.
It's important that we end this pandemic because this is crazy. Unprecedented times, obviously, in the world. I never thought in my lifetime this would happen. So anything we can do from the cannabis industry side to normalize cannabis and show that we're good people, I think it's important.
It is raising awareness. We support the idea that we need to encourage people to take the vaccine. There are people who discourage that or they're reluctant. This seems to have raised that awareness, and people that are coming up here are telling me that it did make a difference, and they're coming up and they've gotten the shot and they're looking for that pre-roll.
So you're saying it's working?
It appears to me it's working.
And that city official mentioned to me a little bit later that it was a little bit weird for him to see this process because just several years ago, he was actually having to arrest people as an officer for marijuana possession. Now he sees it's having a positive impact on his community. You know, the owner says that he didn't think that people will go out and get their shots because of this. But again, it's his way of adding a little bit more incentive to this process as we talk about getting more people to get that vaccine, especially once the rollout speeds up and once the supply picks up. Allison?
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.